Good morning. Thank you very much for the information, your comments. I'm Lynn Ostrowski. I work at Health New England, which is based in Massachusetts. And so what we've seen in Massachusetts, you talked a lot about mergers and acquisitions, and what we've seen is those actually drive up the cost of care and do not impact the quality of the overall care. So how will you regulate those and look at those and review those, and what requirements will you put on them? We have the Health Policy Council in Massachusetts, and as you know, they've just denied the partners, and now that's going to court. So I think that's a big issue for the state of Connecticut as well.
So is that your question, what they're putting in place in terms
And
of
as well
monitoring?
as another comment of throughout the entire discussion, when we talk about the onset of mental health, we talk about it happening in adolescence, and there has been no discussion of the school department and school policies around when these kids get in trouble, they get suspended. And when they get suspended, they get in more trouble and they get arrested. And then they get into the juvenile system. And there's no coordination between the educational system, the juvenile justice system, and the mental health system.
So you're asking two questions of the panel here in Connecticut?
Yes.
One, the first question about mergers and acquisitions and oversight, and the second about coordination for children. Who wants to take that on? Pat.
I can talk about the mergers and acquisitions and the way we handle them for behavioral health in Connecticut. So we don't have any regulatory authority around mergers and acquisitions. We support them. We think that there are some economies that can be gained by them, and we've seen that happen with some of the mergers. And so our stance as the department is simply, if you're going to merge or you're going to change your structure, you have to work with us around contracts. And so if we have two entities that merge entirely, you don't necessarily get to keep your contract because of the merger, right? So we have to issue new contracts. I will say that we have never not been able to work that out. It has never been a problem for us. So it may be just a little different than in Massachusetts.
Somebody want to take? Brian, I think the children and adolescents and all the departments working together.
Yeah, I think that has been a concern over years. I think that we're trying to do a better job of that now in Connecticut rather than go with this zero tolerance policy, which just involves more kids in the juvenile justice system, to really try more early intervention. There are some school-based mental health clinics. Also, there are what's called emergency mobile psychiatric services that people in the community and schools can access if a child is out of control, to try to calm things down, maybe see them over a brief period of time, and then if they need to be linked to community-based services, to do that, to really try to get them the help that they need rather than to punish them.
Great.
So that's a very important point.
Thank you.